The purpose of this video is to help you understand how nitric oxide therapy can naturally address heart disease in Black Americans. Now, two important distinctions before we get started. First, we chose the term Black Americans over African Americans because not all blacks are from Africa, which immediately brings us to the second distinction. We chose the term heart disease over cardiovascular disease because more people identify with heart disease. Yet the number one killer of people worldwide is cardiovascular disease. And unfortunately, it's even worse for the black community regardless of your country of origin. Our video will help you understand why. But more importantly, our video will help you understand how you can use nitric oxide therapy to naturally reduce your risk for both cardiovascular and heart disease. With this in mind, we need to understand the key components for both. When we talk about using nitric oxide therapy to naturally address cardiovascular disease, we focus on a tissue called the endothelium, which lines all of your cardiovascular system, and how it uses the miracle molecule called nitric oxide to lower your risk for high blood pressure, stroke, heart attack, diabetic complications, poor wound healing, and ED issues. But before we discuss how nitric oxide can naturally address these issues, it's important to understand the depth of the problem. The following chart is a direct comparison of cardiovascular disease and stroke when black men and women are compared to white men and women. 44% of black men will end up with some form of cardiovascular disease compared to 37% for white men. This is 7% higher. And the difference is even greater for women. 49% of black women will end up with some form of cardiovascular disease compared to 32% for white women. That's a 17% difference. And more importantly, it means that almost one half of all black women will die from either a stroke or heart disease. Pretty sobering until you understand that there is a natural way to substantially reduce this number. That natural way is nitric oxide therapy. Now, you may be wondering why you've never heard of this natural method, especially since the 1998 Nobel Prize in Medicine was awarded to 3 American researchers who discovered how the lining of your cardiovascular system, which is called the endothelium, converts the amino acid L-arginine into nitric oxide, the master signaling molecule of your entire cardiovascular system, which set off an explosion of research in this area. There are now more than 100,000 peer-reviewed clinical studies in the area of nitric oxide therapy. Yet even in 2017, when this video was produced, most people have never heard of this natural way to address cardiovascular health concerns. Today, that changes, because once you understand the proper application of this information, you'll have the ability to apply this knowledge to address the underlying cause of most cardiovascular health concerns. That cause is what the medical community refers to as endothelial dysfunction, or in most cases, atherosclerosis. As you can see by the slide, damage to the lining of your cardiovascular system accumulates over time. This results in cardiovascular health concerns and a dramatic reduction in nitric oxide production. As we've already mentioned, this lining is called the endothelium. When healthy, it regulates almost all of your cardiovascular system. However, there are 4 major items that directly damage your endothelium. They are high blood pressure, high blood sugar levels, LDL cholesterol, or more specifically, very low density lipoprotein, and nicotine. Going back to our previous slide, this damage starts out as inflammation. If this inflammation is not directly dealt with, then your body treats it like an injury. Through a combination of factors, this results in what's known as plaque formation. Over time, this plaque formation grows, which reduces blood flow. Commonly called atherosclerosis, this narrowing of the arteries reduces blood flow and the delivery of oxygen and nutrients, as well as the proper removal of metabolic and cellular waste products. As this plaque ages, it also becomes brittle and can more easily rupture, causing a blood clot that can then lead to a heart attack or stroke. and as you can see by the slide, a drastic reduction in nitric oxide production. So the question is, why is nitric oxide so important to your cardiovascular health? Before I answer that question, you need to understand two factors that are unique to the Black community and how they increase your risk for cardiovascular concerns. There are two genetic polymorphisms or predispositions that are inherent to the Black population. The first genetic predisposition is that Black people often have higher levels of an enzyme called arginase in their bloodstream. Everyone has this enzyme, which is used to rid your body of harmful ammonia waste products. Unfortunately, arginase converts the amino acid L-arginine, which your body uses to produce nitric oxide, into another chemical compound. This severely reduces your endothelium's ability to properly produce this miracle molecule. The second genetic predisposition in the Black community is low levels of vitamin D in their bloodstream. This can lead to a host of other health issues, which includes an increased risk for both diabetes and cardiovascular disease. So how do you combat these issues and help your endothelium create the needed nitric oxide? Well, before we answer that question, we need to help you understand that there is hope. And while this is just one example, it's common to what can happen when you apply the power of nitric oxide therapy to improve your health. Donald Clark. In 2007, Donald was diagnosed with peripheral arterial disease, or PAD, which dramatically affected his health. This disease is a narrowing of the peripheral arteries in the legs, usually due to atherosclerosis, which again is the buildup of plaque formations. This results in reduced blood flow and an increased potential for blood clots that could lead to a heart attack or stroke. Donald's symptoms were severe leg pain, especially when he tried to walk. Donald's doctor suggested that he use nitric oxide therapy by consuming the amino acid L-arginine to naturally address this issue. Donald followed the instructions from his doctor, and as you can see by Donald's test results, 6 weeks later he had a 50% improvement in blood flow. A couple of years ago, Donald came across information on nitric oxide therapy that caused him to add additional ingredients to his program. Once again, Donald experienced further improvements in blood flow. On the screen is Donald's test results from 2015 when his doctor repeated his ABI test. These readings placed Donald at the high end of the normal range and prompted his physician to make the comment that Donald now had, quote, the arteries of a 29-year-old, end of quote. So how did Donald, who's in his 60s, end up with, quote, the arteries of a 29-year-old, end of quote? We believe the answer is nitric oxide therapy, which is a natural way to address most cardiovascular health challenges and diabetic complications. Which brings us back to the question, why is nitric oxide so important to your cardiovascular health? And the answer is 3 key benefits. First, nitric oxide relaxes the smooth muscle of the vascular wall, causing vasodilation for improved blood flow. This is extremely beneficial for the majority of Black people with high blood pressure. In fact, helping your endothelium produce higher levels of nitric oxide is a natural way to bring your blood pressure back into the normal range. And since high blood pressure is the #1 risk factor for strokes and heart attacks, as well as the #1 diabetic complication, this can be a natural method for addressing these issues. The second key benefit of nitric oxide is that it keeps blood platelet cells from sticking together. This helps to reduce the risk for strokes or heart attacks. And the third key benefit is that when your nitric oxide levels are high enough over a long enough period of time, they can initiate reparative mechanisms to heal the damage done to the endothelium. This includes the reversal of plaque formations and helps to prevent vascular inflammation. This process restores more of your endothelium back to a healthy tissue, which leads to higher levels of nitric oxide to help continue this healing process. Now, when we highlighted Donald Clark, we briefly mentioned properly nourishing his endothelium to optimize its nitric oxide production. Today we're going to introduce you to several key natural ingredients that when properly combined can have a profound effect in restoring the ability of your endothelium to properly produce nitric oxide. In fact, we would recommend everyone getting out a pen and paper to write down the following key ingredients, because two of them are also going to address the two genetic polymorphisms or predispositions that are inherent to the black community. When it comes to optimizing the ability of the enzymes of the endothelium to produce higher levels of nitric oxide, the following ingredients are needed: L-arginine, L-citrulline, resveratrol or red wine extract, vitamin D3, vitamin K2, pomegranate fruit concentrate. L-arginine is always the first and most important ingredient. As we showed earlier, the 1998 Nobel Prize in Medicine was awarded to 3 American researchers for discovering how your endothelium converts the amino acid L-arginine into nitric oxide, the master signaling molecule of your entire cardiovascular system. And while L-arginine can be found in the food you eat, the easiest method to make sure you're consuming enough of this amino acid is to use a daily nutritional supplement that contains pure, free-form L-arginine that's also pharmaceutical grade. Pharmaceutical grade means that it meets the highest standard set for optimal absorption of this amino acid. For most people, the use of L-arginine by itself is not enough. The conversion of L-arginine to nitric oxide only provides a 2-hour window of improved nitric oxide production. Then within 4 to 6 hours, most people are back to their baseline levels. This results in a temporary increase in blood flow, but not long-lasting benefits. If you want to optimize your production of nitric oxide, then you must combine the L-arginine with L-citrulline. This amino acid is metabolized to yield more L-arginine to enhance the ability of the enzymes of the endothelium to produce higher amounts of nitric oxide over a much longer period of time. Here's the metabolic pathway. And as you can see by the red circle, L-citrulline is key to keeping this nitric oxide production going. Additionally, because of how L-citrulline fits into this enzymatic process for the creation of nitric oxide, it will naturally bypass the arginase enzyme that we talked about before. Arginase changes L-arginine into another chemical compound, which removes it from the nitric oxide pathway. But arginase has no effect on L-citrulline, which can then be converted to L-arginine to enable the enzymes of the endothelium to create the needed levels of nitric oxide. This is a critical ingredient, and the only good natural food source for L-citrulline is watermelon. Unfortunately, 60% of the L-citrulline is contained in the rind portion, which most people typically throw away. So unless you juice the entire watermelon to get adequate amounts of L-citrulline, you're better off getting a pharmaceutical-grade L-citrulline supplement, which is also free-form. Free-form means that there are no molecules like malate attached to the L-citrulline. The next key ingredient is resveratrol or red wine extract. First off, this is a polyphenol and has absolutely no alcohol content. It's important to have this key ingredient because it helps reduce LDL oxidation, which typically causes vascular inflammation, leading to plaque formation and damage to your endothelium. Vitamin D3 and vitamin K2 work together to regulate calcium levels in your bloodstream. Calcium is a key ingredient because the enzymatic production of nitric oxide by your endothelium is a calcium-dependent reaction. Additionally, vitamin D3 supports healthy cardiovascular function and inflammatory response. And for black population groups, increasing the vitamin D levels in your bloodstream addresses the second genetic predisposition in the black community. There are numerous clinical studies that show how increasing your vitamin D levels in your blood can have a profound benefit in helping to prevent diabetic and cardiovascular complications. Now let's look at vitamin K. You need to know that the form of vitamin K is critical. Many companies use vitamin K1 because it's significantly cheaper to use. The problem is vitamin K1 does not support vascular health and may actually interfere with blood thinning medications. Vitamin K2 is just the opposite. This correct form significantly improves arterial and cardiovascular health. It also plays an important role in preventing calcification of the arteries as well as soft tissues like your heart, lungs, and kidneys. Finally, we have pomegranate fruit concentrate. This ingredient enhances the enzymatic activity of the endothelium, leading to higher production of nitric oxide. In peer-reviewed clinical studies, pomegranate fruit concentrate has been shown to reverse plaque formations within the vascular system because of its ability to increase nitric oxide production. Now, throughout this presentation, I've used the word I and we. I'm part of the Million Lives Project. Our goal is to get into the hands of 1 million people or more information on how nitric oxide therapy can be a natural way to address most cardiovascular health concerns. And while this video specifically addresses the Black community, the information applies to everyone. With this in mind, we created our nitric oxide therapy ebook. If you would like this ebook, then please contact the person who invited you to this presentation. They're also a part of the Million Lives Project. And if you came across this video on your own, then please contact Dan Hammer. You can either call him directly at 1-800-966-3012 or email him at dan@agingnomore.com and he will email you this ebook. Now, before we end this video, I'd like to highlight 5 cardiovascular health issues so that you can see how the proper application of nitric oxide therapy could be beneficial. Let's start with high blood pressure because it's the #1 risk factor for strokes and heart attacks, as well as one of the leading causes of atherosclerosis that contributes to endothelial dysfunction. As your cardiovascular system narrows, it increases the resistance to blood flow, causing an elevation in blood pressure. To counter this, you need to reduce this resistance to blood flow. Nitric oxide does this by relaxing the smooth muscle of your vascular wall, which lowers the resistance to blood flow. For many, this one simple step helps to return your blood pressure back into the normal range. The next major cardiovascular health issue is diabetes. This is a huge issue for Black Americans because 60% more Blacks are affected when compared to whites. As we discussed earlier, high blood sugar levels cause direct damage to the lining of your cardiovascular system, and most diabetic complications are a result of this cumulative damage over time. However, when you increase your baseline levels of nitric oxide, you begin to initiate reparative mechanisms that begin to heal this damage. This begins to restore more of your endothelium back into a healthy tissue. And if properly nourished with the key ingredients that we talked about earlier, you can continue to increase the nitric oxide levels in your bloodstream. This improves blood flow and continues this healing process, which helps most diabetics naturally address their cardiovascular health concerns. One of which is poor wound healing. According to the National Institutes of Health, quote, arginine is a semi-essential amino acid that is required during periods of maximal growth, severe stress, and injury. Arginine has many effects in the body, including modulation of immune function, wound healing, hormone secretion, vascular tone, and endothelial function. Arginine is also a precursor to proline, and as such, sufficient arginine levels are needed to support collagen deposition, angiogenesis, and wound contraction. End of quote. What this means is that the amino acid L-arginine, nitric oxide, and your endothelium are all involved in the wound healing process. The next issue is reducing your risk factors for having a stroke. This is critical when you understand the following sobering statistics. Blacks are twice as likely to die from a stroke as whites. The rate of having a first stroke is almost double that of whites. And 1/2 of all Black women will die from either a stroke or heart attack. According to the American Heart Association, 87% of all strokes are ischemic strokes. An ischemic stroke occurs when a blood clot forms in the bloodstream. This blood clot then lodges within an artery of the brain, causing a blockage. This blockage reduces the necessary blood flow to that section of the brain, leading to damage or death to those brain cells. The amount of damage determines the severity of the stroke. Plus, high blood pressure is the #1 risk factor contributing to a stroke. Both of these issues, high blood pressure and blood clot formations, result predominantly from endothelial cell dysfunction and its inability to properly produce nitric oxide. This information helps us to clearly identify 3 keys to substantially reducing the risk for a stroke. They are controlling blood pressure, preventing blood clots, reversing endothelial cell dysfunction. And as we've already shared with you, nitric oxide therapy addresses each one of these issues. To emphasize this point, I'd like to read a short quote from the book No More Heart Disease, whose author is Nobel laureate in medicine Dr. Luis Ignarro. Quote, 2 of NO's critical functions, preventing the formation of blood clots and keeping the arteries free of plaque, work specifically against the occurrence of stroke. End of quote. Finally, let's talk about ED, or erectile dysfunction in men. There are 2 forces at work, vasodilation and vasoconstriction. For a man to have an erection, he needs nitric oxide to start and maintain the vasodilation side of the equation. If his nitric oxide levels are too low, no erection. If his nitric oxide levels are reduced, then he can most likely start the erection but not maintain it. And the reason why is this counterbalancing force, which is vasoconstriction. Without this, men would have an erection all day long, which would be a bit embarrassing and uncomfortable. The way Viagra and Cialis work is that they use a chemical to disable the vasoconstriction side of the equation. This works until a man's nitric oxide levels in their bloodstream get so low that they can no longer create the needed vasodilation. This means drugs like Viagra don't address the underlying cause, which for most men is endothelial dysfunction and lack of sufficient nitric oxide production. Nitric oxide therapy can help address this issue by optimizing nitric oxide production. This leads to increasing baseline levels of nitric oxide, which can then initiate repair mechanisms to heal damage to the endothelium. This returns more of this tissue back to a healthy functioning tissue, producing more nitric oxide. For black men, the result will be more morning erections like they had when they were younger. Now, 2 final items before we end this video. First, our goal is to help 1 million people or more understand how they could effectively use nitric oxide therapy to significantly improve their overall health. How nitric oxide therapy can reduce your risk for cardiovascular health concerns like high blood pressure, diabetes, poor wound healing, stroke prevention, and sexual health issues. One of the primary ways we do this is through our ebook, which is titled Empower Your Heart with Breakthrough Nitric Oxide Therapy. If you found value in the information contained in this video, then please contact the person who shared this information with you. They can help you obtain our ebook on nitric oxide therapy. Second, we get asked all the time, is there a product that can help me restore my nitric oxide levels? And the answer is there are hundreds of products, but our product of choice is Pro-Arginine Plus from Synergy Worldwide, and here's why. It's the only L-arginine supplement recognized by the medical community. It's been listed for the last 3 years in the physician's desk reference, and here's the exact first-line quote. Pro-Arginine Plus is the highest quality L-arginine supplement in the world. Additionally, Pro-Arginine Plus is the only clinically proven L-arginine supplement in the marketplace. It's been clinically proven to produce higher levels of nitric oxide than L-arginine alone, but more importantly, it's been clinically proven to prevent vascular inflammation in 2 very specific ways. And there are 262 verified quality assurance steps to guarantee product results. If the use of this product interests you, then please talk with the person who invited you to this presentation. or contact Dan Hammer either by email using dan@agingnomore.com or by calling him directly at 1-800-966-3012. Let's empower the Black community to naturally address heart and cardiovascular disease through nitric oxide therapy.